During IVF, eggs are fertilized in the laboratory and carefully cultured into healthy embryos before transfer to the uterus. Fraternal twins usually result from two implanted embryos, while identical twins occur when a single embryo naturally splits after fertilization. During IVF, fertilized embryos are carefully grown in the laboratory before being transferred into the uterus. Triplets may occur when multiple embryos implant, or more rarely, when one transferred embryo naturally divides into identical twins. Triplet pregnancies after IVF are uncommon. Today's fertility specialists usually recommend transferring fewer embryos to reduce the risk of high-order multiple pregnancies. During IVF, fertilized embryos develop in the laboratory before being transferred into the uterus. Fraternal twins develop from two separate embryos, while identical twins occur when one embryo naturally divides into two. IVF can increase the chance of fraternal twins when more than one embryo is transferred. Identical twins remain rare and result from the natural splitting of a single embryo after fertilization.
IVF begins by stimulating the ovaries to produce mature eggs, which are carefully collected and fertilized with sperm in a specialized laboratory. Over the next several days, the embryo divides and develops into a blastocyst, allowing specialists to select the healthiest embryo for transfer. The selected embryo is gently transferred into the uterus, where successful implantation can mark the beginning of pregnancy. During the first trimester, 3 embryos implant and the uterus begins an extraordinary transformation to support all 3 developing babies. As the babies grow, the uterus expands dramatically while maternal blood flow, placental function, and surrounding organs adapt to meet increasing demands. Triplet pregnancies require close prenatal monitoring because the mother's body is supporting 3 developing babies, making expert obstetric care essential for the healthiest possible outcome. During the first trimester, 2 embryos implant, 2 placentas or a shared placenta begin forming, and the mother's body rapidly adapts to support both babies. Throughout the second trimester, both babies grow rapidly while the uterus, placenta, and maternal circulation expand to meet their increasing nutritional needs. By the third trimester, both babies continue maturing as the mother's body prepares for birth. Twin pregnancies require close prenatal monitoring to support the health of both mother and babies.
After fertilization, embryologists carefully evaluate embryo quality before deciding how many embryos should be transferred. Single embryo transfer aims for 1 healthy pregnancy, while transferring 2 embryos may increase the chance of twins if both implant. For many patients, modern fertility specialists recommend single embryo transfer because it can achieve excellent pregnancy success while lowering the risks associated with twin pregnancy.
A twin pregnancy brings the joy of 2 babies, but it also places greater demands on the mother's body and requires closer medical monitoring. Twin pregnancies have a higher risk of premature birth, preeclampsia, gestational diabetes, and other complications that require specialized prenatal care. With regular prenatal care, ultrasound monitoring, and early detection of complications, many twin pregnancies result in healthy mothers and healthy babies.
After embryo transfer, successful implantation marks the beginning of pregnancy, just as it does in naturally conceived pregnancies. During weeks 5 to 8, the embryo develops major organs, a heartbeat, and the placenta that will support growth throughout pregnancy. After successful implantation, IVF pregnancies generally follow the same developmental milestones as other pregnancies, with prenatal care tailored to each individual. During IVF, fertility specialists carefully select the healthiest embryos before deciding how many to transfer into the uterus. Transferring more than 1 embryo can increase the likelihood of twins, but implantation is never guaranteed, and identical twins can occur when a single embryo naturally split. Today, fertility specialists usually recommend single embryo transfer for many patients because it provides excellent pregnancy success while reducing the risks associated with twin pregnancy.